diabetes, the way we defined it, is a dysfunction of carbohydrate metabolism because it's mainly diagnosed based on what the blood glucose level is. The main function here is what happens to the glucose levels that are circulating. In normal individuals, the glucose levels are controlled in a very narrow concentration range. So there are fasting levels, and then with meals, there's very small excursions. In diabetics, the glucose levels are high, both at fasting and then also what's called postprandially after a meal. And the reason for this is at least twofold. One is there's a dysfunction in the peripheral tissues. And the important peripheral tissues that respond to insulin would be primarily the adipose, the muscle, and the liver. And these are important both in terms of how they take up glucose, and with the liver is also important in terms of how much glucose it resupplies back to the circulation. Normally these things are controlled under very tight fashion by controlling the way the insulin works on these target tissues, but also in controlling the amount of insulin that's released from the pancreatic islands. So in the pancreas, there are islands of cells here, and primarily it's the beta cells in those islets that are both making and secreting insulin. And it's important to release just the right amount of insulin and at the right times and the right amount in order to get this very precise control. In diabetes, this function goes awry. So we lose not only the response of the peripheral tissues, but we also lose the ability of the pancreas to make and secrete insulin. And this is important because the way things are today, by the time a type 2 diabetic is diagnosed as diabetic, they've already lost about 80% of these cells. And this is something that can be prevented. If you had a treatment early on that would directly affect these cells and their function, and our compounds we believe are doing this and will do this on the long term, you can prevent this loss of pancreatic function. So the compounds then will not only improve the way insulin works in the periphery to help lower glucose, but also preserve the pancreas so that you don't lose function with time. Now this is very important because the current treatments that we have affect just the symptoms, not the cause of the disease. And so your physician now only has several options. They can add on options when they fail. And most of the options fail eventually because they don't really correct the main problem. And so what we're looking at to do here is with this treatment to affect this metabolic dysfunction through this metabolic solution that we believe we can have with these compounds is to treat diabetes at its cause and not just the symptoms.